What if the most dangerous moment of your life came and went without you even noticing? What if your body sent you a clear, unmistakable warning 30 days in advance, and you looked right at it, shrugged, and went back to watching television? That is not a hypothetical. That is what happens to hundreds of thousands of people every single year. They get the warning. They miss it. And 30 days later, they are in an ambulance. Here is what makes this so painful to talk about. Heart attacks are not supposed to be surprises. The human body is not built to fail without warning. It is built to communicate, to signal, to whisper before it screams. The problem is that we have been taught to listen for the wrong things. We have been taught to wait for the chest-crushing, arm-numbing, dramatic collapse that we see in movies. And so when the real warning shows up, quiet, easy to explain away, dressed like something ordinary, we completely miss it. My name is Dr. James Harmon. I have been a cardiologist for over 20 years. I have sat across from patients in recovery rooms, in ICU wards, in follow-up appointments after the worst moments of their lives. And almost every single time, when I ask them to walk me back through the 30 days before their heart attack, the same conversation happens. I describe a symptom. Their eyes go wide. And they say, "Doctor, I had that. I thought it was nothing." That moment, that specific moment of recognition after the fact, is what I cannot get out of my head. Because if they had known what it meant when it was happening, we might never have needed that conversation at all. That is exactly why I am here today. Not to frighten you. Not to send you spiraling into anxiety every time you feel tired. But to give you the information that could genuinely, literally, change the outcome of your life or the life of someone you love. Stay with me until the end, because the sign I am going to reveal is not the one you are expecting. It is not chest pain. It is not shortness of breath. It is something far more subtle, far more common, and far more consistently ignored. And the science behind it is both fascinating and deeply alarming. But first, I need you to understand something fundamental about how a heart attack actually builds. Because most people think of it as a sudden event. A switch that flips. A wire that snaps. And that mental model is costing lives. Picture your coronary arteries, the vessels that deliver blood and oxygen directly to your heart muscle, as a busy highway system. For years, sometimes decades, small deposits of fat, cholesterol, calcium, and inflammatory debris have been quietly accumulating along the walls of that highway. These deposits are called plaques. Most of the time, they grow slowly. They narrow the road a little, reduce the flow a little, but the heart adapts. It compensates. It keeps going. This is why heart disease can live inside a person for 20 or 30 years with almost no symptoms at all. But here is where it gets critical. These plaques are not stable. They are volatile, living structures. And when one of them becomes inflamed or unstable, triggered by stress, by a spike in blood pressure, by a surge of adrenaline, by the cumulative damage of months or years of poor circulation, it can rupture. When a plaque ruptures, the body treats it like a wound. It sends clotting agents rushing to the site. A blood clot forms rapidly. And if that clot is large enough to completely block the artery, the heart muscle beyond that blockage stops receiving oxygen. Within minutes, cells begin to die. That is a heart attack. Now here is the part that changes everything. In the weeks and days before that plaque ruptures, the body already knows something is wrong. It cannot tell you in words. But it speaks in symptoms. Small, easy to dismiss, perfectly disguised symptoms. And the most consistently documented one, the one that appears in study after study, the one that my own patients describe again and again, is one that almost no one connects to the heart. Profound, unexplained fatigue. Not ordinary tiredness. Not the kind you feel after a long day or a poor night's sleep. I am talking about a specific, heavy, relentless exhaustion that seems to have no cause and no cure. You sleep 8 hours and wake up feeling like you barely slept at all. You sit down to do something simple, fold laundry, walk to the kitchen, climb a single flight of stairs, and you feel a heaviness, a depletion, that is completely out of proportion to the effort. It is fatigue that does not respond to rest. Fatigue that settles into your bones and stays there. Fatigue that you find yourself trying to explain away. I must be getting older, the weather has been strange, I've been a little stressed. And here is why this happens. When a coronary artery is becoming progressively blocked, the heart muscle it supplies starts receiving less oxygen than it needs. The heart is working constantly, 60, 70, 80 beats per minute, every minute of every day, and when its own fuel supply is compromised, it begins to struggle. The body, sensing this struggle, starts redirecting energy. It pulls resources away from your muscles, your brain, your digestive system, in a desperate attempt to support the heart. The result, experienced from the inside, is that bone-deep, unexplainable exhaustion. A landmark study published in the journal Circulation, involving over 500 women who had survived heart attacks, found that over 70% reported experiencing unusual fatigue in the weeks leading up to their cardiac event. 70%. Not chest pain. Not arm pain. Fatigue. And the majority of them had dismissed it entirely. This is not exclusively a female phenomenon, though women are disproportionately affected and disproportionately misdiagnosed because of it. Men experience this warning sign too. They simply tend to push through it more aggressively and report it less frequently, which makes the eventual outcome, when it comes, even more catastrophic. I want to tell you about a man named Gerald. He was 64 years old, a retired schoolteacher from Ohio. His wife brought him to see me about 6 weeks after his heart attack, once he was stable enough for a full cardiac consultation. Gerald was the kind of man who walked 3 miles every morning, ate reasonably well, kept his doctor's appointments. Not a high-risk profile on paper. But when we talked about the weeks before his heart attack, Gerald's wife started nodding before he even finished his first sentence. She said, I kept asking him what was wrong. He just wasn't himself. Gerald described it like this. About a month before the heart attack, he started waking up tired no matter how much he slept. He would sit in his armchair to read the newspaper and fall asleep within 10 minutes, which had never happened to him before in his life. He stopped wanting to take his morning walks, not because anything hurt, but because the idea of the effort felt overwhelming in a way he couldn't explain. He assumed he was fighting off a virus. He assumed it was the heat. He told himself he was fine. 32 days after the fatigue began, Gerald had a massive heart attack in his living room. His wife called 911. He survived, but the damage to his heart muscle was significant and permanent. If someone had told me, Gerald said to me, that this kind of tiredness meant something, I would have called my doctor immediately. I just didn't know. That conversation haunts me. Because Gerald is not an outlier. Gerald is the rule. Now, I want to be precise here, because this is important. Not every bout of fatigue means a heart attack is coming. I am not asking you to panic every time you feel tired. What I am asking you to do is know the difference. There are specific characteristics that separate cardiac fatigue from ordinary tiredness, and recognizing them could be the most valuable thing you do today. Cardiac warning fatigue tends to be sudden in its onset. It appears without a clear trigger, no illness, no dramatic change in sleep, no obvious explanation. It is persistent, meaning it does not significantly improve with rest or sleep. It often comes accompanied by other subtle signs, a vague sense of pressure or discomfort in the chest that comes and goes, mild shortness of breath during activities that normally present no difficulty whatsoever, a slight swelling in the ankles or feet in the evening, occasional heart palpitations that feel like a flutter or a skipped beat, and in some people, a feeling of low-level anxiety or unease that they cannot attribute to anything specific, as if the body is sending an alarm signal that the conscious mind cannot quite decode. It is the combination of these signals, not just the fatigue alone, that should raise a red flag. One of these symptoms in isolation, especially in someone over 50, is worth mentioning to a doctor. Several of them together, appearing within the same 2 to 4 week window, is a reason to stop what you are doing and seek evaluation today. I need to tell you about Margaret next. She was 71, a retired nurse from Georgia, which makes her story particularly striking. She knew medicine. She had spent 40 years in hospitals. And yet when her own warning signs appeared, she rationalized them away just like everyone else does. She told me later, I kept thinking, I would know if something was seriously wrong. I would feel it. She felt profoundly tired for 3 weeks. She noticed that walking from her bedroom to the kitchen left her slightly breathless in a way it never had before. She felt a strange, dull ache across her upper back and jaw that she attributed to tension and sleeping in an awkward position. She did not call her doctor. She was a nurse, and she still did not call her doctor because the symptoms did not fit the picture in her head of what a heart attack warning looks like. On day 26, she had a cardiac event at home. Her neighbor found her and called for help. She survived. But when she sat across from me in recovery and I described the warning signs she had experienced, she put her face in her hands and was silent for a long time. Then she said, I taught this to patients for 30 years. And I still missed it in myself. This is the power of the mismatch between what we expect heart disease to look like and what it actually looks like. We are all vulnerable to it, regardless of how much we know. So what do you do with this information? Here is a clear, practical path forward.
The first thing you do is start paying attention to your baseline. You know your body. You know what your normal energy level feels like, what your normal exercise tolerance is, what a typical night of sleep does for you. When something shifts, when your body starts operating noticeably below its own normal, that shift deserves attention, not explanation. Do not reach for reasons to dismiss it. Reach for your phone and call your doctor. The second thing is to take note of combinations. A single symptom is worth monitoring. 2 or more of the symptoms I described, fatigue, mild breathlessness, ankle swelling, chest discomfort, palpitations, jaw or backache, appearing together within the same few weeks, is a reason to seek evaluation without delay. Tell your doctor specifically what you are experiencing and specifically when it started. Keep a simple note in your phone if it helps you remember. These details matter enormously for diagnosis. The third thing is to know your numbers. High blood pressure and high cholesterol are the 2 most powerful accelerants of plaque buildup in coronary arteries, and both can exist for years without producing a single symptom. If you are over 50 and you have not had these checked recently, that is your most important next step. A simple blood test and a blood pressure reading can tell your doctor an enormous amount about the state of your cardiovascular system. This is not optional maintenance. This is essential information. The fourth thing, and I say this with complete seriousness, is to stop treating cardiac symptoms as things to endure until they go away. There is a deeply ingrained tendency, particularly among older adults, particularly among men, to push through discomfort, to avoid making a fuss, to not want to bother anyone with something that might turn out to be nothing. I understand that instinct, but I want you to hear me clearly. A cardiac workup that comes back normal is not a waste of time. A heart attack that could have been prevented is a catastrophe. There is no version of this equation where waiting is the smarter choice. And the fifth thing is perhaps the most important of all. Share this information. Right now, think of one person in your life who is over 50, who pushes through fatigue, who waves off symptoms, who has not seen a doctor in longer than they should. A parent, a sibling, a spouse, a close friend. Send them this. Not because you want to frighten them, but because the information that prevents a tragedy is worth 30 seconds of your time. Gerald's wife did not know what to watch for. Margaret's family did not know. The people who love the people at risk are often the first ones to notice that something has changed, and they need to know what that change might mean. We have covered something significant today. The heart does not go silent before it fails. It speaks. It sends messengers weeks in advance. But those messengers do not wear badges or carry signs. They arrive disguised as ordinary tiredness, as getting older, as nothing worth worrying about. The difference between a person who heeds those messengers and a person who dismisses them is almost never intelligence or health knowledge. It is almost always information. Knowing what to look for, knowing that the thing you are feeling has a name and a meaning and an urgency that does not match how gentle it feels. You have that information now. What you do with it is the only thing that matters. If this gave you something today, if there is a symptom you are going to pay closer attention to, a doctor's appointment you are going to schedule, a person you are going to call, then it did exactly what it was supposed to. Give it a like so that it reaches more people who need it. Share it with someone who should hear it. And subscribe if you are not already here, because what I am bringing you next is something that almost no one is talking about. In the next video, I'm going to reveal the 5 foods that cardiologists eat every single day to protect their own hearts, and the 3 foods they never touch, no matter what. The answers to both of those lists are going to surprise you. Do not miss that one. I am Dr. James Harmon. Your heart has been working for you every second of every day of your life without a single break, without asking for anything in return. Today, you gave it something back. Take care of it. It's the only one you have.